Good evening friends, I am Dr. Colonel Rajesh Khanduja, consultant nephrologist at Tagore Hospital, Jalandhar. Today I will talk about heart failure and edema. Now, as we all know, the heart is the hardest, most hard-working organ of the body and pumps about 2000 gallons of blood every day. And this happens round the clock, day and night, and without us coming to know of it also, even during when we are sleeping. So when we hear the term heart failure, then it becomes very frightening. But actually, it is not that the heart is not working, or it has just stopped working, or it has failed totally. Only thing is, it is not working as efficiently as it should be. And this can be happened because of various reasons to the heart. This may be because of heart attack to the heart, and that is when a part of the blood supply of the heart is affected, so it cannot function properly. This may be because of blood pressure, or there may be heart diseases, which we will not discuss any further. Also, diseases like kidney disease and diabetes can also cause damage to the heart. So these conditions lead to evolution of the heart failure. Now, I will talk a little about the different types of heart failure that we have. So, one is when we say there is a heart failure, that means there is reduced capacity of the heart to function. Now, this can be divided into right heart failure and left heart failure. Right, as we all know, heart has two sides, left side and right side. So, when the right side fails, we call it right heart failure, and when the left side is not able to function properly, we call it left heart failure. So, it is that when the left side fails, the blood is coming to the heart, but it is not able to send it back to the bodies. So, and that is when it accumulates in the lungs, and this is called pulmonary edema. On the other hand, when the right side fails, the blood is coming to the heart, it is not able to send it forward, so it accumulates in the body, and that is how we get swelling of the feet, swelling of the face, swelling of the abdomen, and that is called right heart failure. So it is simple. Whenever there is heart failure, right or left, then blood will accumulate, depending on which part of the heart is filled. So let us look at the signs and symptoms, how it will present. It will present as edema or swelling of the feet, swelling of the ankles, swelling of the stomach. It may, if it is in the lungs, it may be shortness of the breath, or wheezing can happen during exercise. And if all this, because of the poor functioning of the heart, if there is not enough blood that is able to circulate, it is not able to pump, then brain will not get the blood, and then there will be confusion. So now we have discussed that there is swelling of the feet or edema. I will talk a few more words about edema per se. Let us try to understand what is edema. So edema is the clinical term, that is the physician's term, as when the swelling of the body takes place because of retention of the fluid. Why retention of fluid is happening? I have told you. Why this leads to swelling? I have told you. And this is called edema. Now the thing is that it is not only the heart failure that can cause edema, it can also be caused by other diseases affecting the liver, affecting the kidney, affecting the heart, as we have discussed, or it may be because of nutrition. So in these conditions, edema can happen because of many reasons. So that is what we need to understand and then decipher, is this edema because of the heart failure or other conditions. So some of the edema that we can discuss, pedal edema is the term that you must have heard, and that is when the edema or the swelling is there in the feet and the ankles and the legs. And if it is peripheral edema, it may be in the hands as well as in the legs. If it is called pitting edema, which means that it is so significant that if you put your finger on the edema, on the swelling, there will be a pit that is formed. It is called pitting edema. And then pulmonary edema is the term that you must have heard, and that is when the fluid accumulates in the lungs. So if all this edema is happening, person will have what symptoms? What are the early symptoms? So feet will start becoming large, the toes will become big, the shoes will not fit, and there will be pain in the legs. Walking is not easy, and weight gain happens. So these are early signs that edema is happening, and which means that heart is going to, right side of the heart is failing. So how does this heart failure occur because of cause edema? Because when blood comes to the heart, it is not able to send back, so it accumulates, and then it accumulates in the wherever it can get a chance. It can even accumulate in the liver, it can even accumulate in the abdomen, it can even accumulate in the limbs. So it is important that we give proper treatment for the heart failure and try to understand the cause, and that is how swelling will be reduced. If swelling is reduced, symptoms will reduce, patient will feel better. So let us look at the treatment options. Now, we must be very clear. Heart failure, the way I have discussed, it is not that simple. And if it is left alone or left untreated, then it can become a life-threatening condition. And so, just home remedies is not good enough. We have to do lifestyle changes, yes. We have to do home remedies, yes. But we also have to take treatment. And treatment is from a cardiologist who will give you medicines. So, what are the lifestyle changes that you can do at home before you go to the cardiologist? You reduce the salt in your diet, because salt is contributing to edema. You reduce the salt, edema is going to get less. You increase physical activity, but not to the extent that heart is put on more burden. But exercise definitely helps the heart to function better. Manage stress so that your brain also gives the right kind of signals to the heart. Now, as far as the treatment by the doctor, I will not discuss that with you right now. But what I have told you, these you should do, and also use stockings. Elevate your foot end when you go to sleep. And this way what will happen is that the swelling of the edema will come down, because the blood will turn to the heart. And I think I have told you that it can be an alarming condition. Heart failure can be an alarming condition. The edema that it causes can get worse and become a problem. But if you look at the treatment options that are available at home with yourself and with the help of your doctor, then they can make a lot of difference and prolong your life. If edema is because of other causes of other system failure, then we will identify those causes and discuss in a next session. Thank you so much for today's hearing.